Before I started nursing school, I had so many expectations. Some of them were spot on, but let's just say others, well, reality did hit hard. If you're considering becoming a student nurse or about to start your course, I'm here to tell you everything that I wish I knew before I started my nursing degree. Before I started nursing school, I thought I knew what I was getting myself into, but nobody gave me an accurate representation of what clinical placements would actually be like. The first point is that not all nurses that you work with will want to teach you, and unfortunately some of them will make it very obvious. Some mentors will take you under their wing, show you the tricks of the trade, and be really eager to teach you and pass on their knowledge. It's so lovely when you get a mentor on placement that actually wants you there and wants to teach you and help you progress in your nursing degree. However, others will act like you're just a bother to their day and that you're just an inconvenience to them just by existing. Sometimes, you're starting a new placement and you go there and everyone's so welcoming and friendly and they really want to, help you achieve all your learning objectives and get all your clinical skills signed off. And other times you go there and you walk onto the ward, you're allocated a supervisor for the day or an assessor, and you're just kind of dilly-dallying, following them around, and it's very evident to you that they don't want you there. So you can just feel it. It's the worst feeling to feel so unwelcomed, and you are there to learn at the end of the day, and you're spending hours of your life helping people for free to get your degree, to make this world a better place. But then these mentors, they don't want to help you. They're just sick of you being there, which sucks. So I have some tips if you do unfortunately experience this. It's sadly quite common. I know so many nursing students, midwifery students, and even medical students who have had mentors like this where they don't want them around. You're just an inconvenience to their day. What can you do in this situation? Now, the best thing to do in this situation is to learn from other healthcare professionals. Try get some outreach facilitated. So that might be shadowing the physiotherapist for the day, or going on the rounds with one of the doctors, or even working with the ward pharmacist and just seeing what they do, because you can take that awful experience and just place yourself somewhere else if possible. If you are struggling with your mentor and they're not treating you right and you're struggling to get stuff signed off and there's not a lot of support, please escalate it to your practice team at your hospital. Every hospital has a practice education team, and you can consult them any time of the day when they're in office. Now, they're representatives for the trust, and they are there to make sure that students and clinical staff are having the best learning experience possible. If anything goes wrong and you're being, harassed, abused, anything like that, that needs to be escalated urgently. Make sure you document everything, even if it's just writing notes on your phone so you remember what has happened. Don't be afraid to speak to your uni if necessary, and if things are too bad, then it's possible to get moved to a different area in most cases. It's really important to speak out when these things happen so then they don't happen again in the future to other students. 2, you will have a lot of awkward and embarrassing moments. You know that feeling when you walk into a room and you forget why you even walked in there in the first place? Yeah, that's pretty much nursing school summed up. There's also silly little awkward moments during consultations or just working with different staff. For example, something so small as struggling to get gloves on after you sanitize because your hands are still a bit moist and they're just sticking to you. This is such a common one that happens literally every day to everyone. It's quite hilarious to watch because it's so relatable. There's also other stuff. For example, when I was on my critical care placement, I was practicing drawing up medication into IV bags. I can't remember the drug I was drawing up, but I was trying to spike the saline bag and it just sprayed everywhere. It was on my face, it was on my glasses, it was just everywhere, and the patient started laughing at me. It felt good to be laughing with them. It's really important not to take these embarrassing moments too seriously because it's a learning curve. Everyone's there to support you. People know that you're a student. Just pay attention and do the best that you can is all anyone can ever ask of you. It's totally normal to have these silly little things happen. I just didn't realize how often it would happen. Yeah, the worst one is when, you're walking down the corridor in the hospital and you just trip. Everyone's there and you're just tripping. Yeah, the amount of times I've just tried to play it off real cool. I'm not cool. Embarrassing moments can feel so big when you're a student nurse, especially when you first begin in your first placements. But trust me, everyone's going to forget in 5 minutes, and it's just a funny experience for you to look back on. So just don't take it to heart too much. Number 3 is that going on to clinical placement will humble you so much. You have all of these textbooks and exams that you need to sit, and you're studying, anatomy, physiology, pharmacology, and you think, you know so much, you did so well on these tests. Then you head into the wards and you're greeted with like hundreds of drugs that you can't even pronounce. And it's such a contrast from studying in the textbook to working in the departments, and just really seeing how the stuff that you learn plays out in real life, if that makes sense. I went into my placement thinking, okay, yeah, I studied, I practiced the clinical skills that we did in our first term, I'm ready. Pretty much when we started our first placement, it was only a month into the first year, so the only clinical skills we had done at that point were, I believe, blood pressure, general observations. I walk into the surgical department where I'm at. I have no idea how to configure this machine that they've got. They've got like a touch screen machine, and I'm like, how do I put the patient information in? How do I press go on the blood pressure cuff? Like, it sounds so stupid, but there's so many different machines that you have to get used to over your time. That was my experience on my first placement. When you're there, you watch nurses do a million things at once and just juggle all of these patients and such complex cases, and you'll just be standing there like, oh my god, that'll be me someday, like doing this all independently. Placement is so important. Honestly, that's the time where I learn the most. I'm constantly learning from the people around me, the doctors, the nurses, healthcare assistants, everyone on the team. I think it's so important when you go on placement to be taking notes of drugs that you've not encountered before, learning the mechanisms of action, side effects, what are they used for, any diseases that you come across, and surgeries, just writing those down and having a little look at them when you can. Pro tip is to always carry around a little notebook. I like the really small pocket-sized ones, so they just fit in the scrub pockets. Always bring a pen. I'm very bad with this because I leave my pens everywhere. So oh, my dog is barking. Okay, he's done. Never mind. I leave my pens everywhere. I'm sorry, they are gone. So look after your pens, guys, because they do go missing. Number 4 is that nothing can really prepare you for the level of sleep exhaustion that you're going to have. Nursing is renowned for being one of the most demanding degrees to do, just because of the amount of stuff that you need to balance in terms of very intense placements. We have lots of exams, lots of things to study. We've got lots of certifications to sign off. We've got too many things. There is so much going on in nursing, especially when it comes to the placements. You're going to start your placements, and more often than not, you're going to be working 12-hour shifts, sometimes even night shifts. It really depends on your university policy. I know you have to do night shifts in order to qualify. Like, you have to have worked different types of shift lengths. So we have day shift, long day, night shift. It's part of the NMC guidelines, I believe. The fatigue that you experience being on placement is hard to comprehend. To give you an example, I'm on placement right now. My eye has been twitching for 8 days. I don't think that's normal. And no amount of caffeine, and it's not from the caffeine, by the way. I stopped the caffeine for 6 days and still is twitching. I don't know what's going on. No amount of caffeine seems to help, because you have this like brain fog once you leave the hospital. You're just kind of in a daze. All you want to do is get home, shower, get clean, wipe everything down, and just like rot in bed. It's really difficult sometimes, especially when you're working in a placement area that's really far away from your home. Say you're working 7:30 a.m. to 8:30 p.m. and you have like an hour and a half, 2-hour commute time. You're not getting home until 10 p.m. and you're gonna have to probably leave before 6 a.m. So how much sleep can you really get, and when are you going to eat? It's really tricky. I just recommend preparing yourself for this and be very open in communicating with your placement areas about what you can and cannot do in terms of how far do you live, and okay, what days would work best for you? Can you do 3 days back to back? That's a lot. That's a lot for anyone. I've done that and it's too much. At times it feels like you're living in the hospital. The next point is that some days will emotionally wreck you. There's going to be days where something really bad happens and you're going to take it home with you sometimes there's nothing more that you can do than keep thinking about that. There will be days that absolutely break you, and it's okay to cry. It's totally normal. It's normal to be affected by the patient encounters that you have. There's so many milestones, like, you know, the first time you lose a patient, the first time you see a family saying goodbye to their loved ones, and the first time that you realize that you can't fix everything. Honestly, everything stays with you, and it will always stay with you, those experiences, particularly your first ones. I remember I was working in an elderly ward, and there was this lady in her 80s, and she had lots of cardiac issues, and her husband of over 60 years was there by her side every hour of the visiting times. I'd see them every single day when I was on shift, and then I came in and just saw him and his son crying by her bedside and saying goodbye, and it was really tough. Like, I had like tears in my eyes, and you know, these things, they really hit home, they really get to you, and it's really important to speak about them. It's so normal in healthcare degrees to try to suppress these dark things that we see every day, but it's so important to speak to each other. You need to get things off your chest. I know there's been so many times where I've come home and I've just absolutely broken down crying, only when I'm, you know, verbalizing what I've seen on that day or what I've experienced does it all make sense why I'm crying. I would think, why am I crying so much right now? Why am I so upset? But then when I hear it back, it makes sense, because you know, we don't go through what someone studying any other degree goes through, because we're there, we're working with the patients, you know, and we're seeing death every day, we're seeing illness every day, we're seeing people on the worst days of their life, which gets to you. My biggest tip for this, again, is to speak to people and have a good post-shift routine. Focus on relaxation, focus on things that make you happy, whether that be taking a nice bath, watching a funny film, journaling, all of these healthy habits. Even exercise can be so good just for clearing the mind and looking after yourself, because at the end of the day, you can't look after other people until you look after yourself. My final point is that you'll experience imposter syndrome. There's times when I'm on placement where I might be taking blood or doing some other clinical skill, and I'm just like, oh wow, this is crazy. Like, I feel like I'm playing dress up. This is where I wanted to be. This is what I wanted to be doing, and I'm here doing these things that are so cool to me. It's a really weird feeling, because it feels like you know nothing, but you do know. Sometimes I'm looking after patients, I'm like, who gave me the right to do this? Of course, we have our supervisors with us. It feels so surreal. I know that so many healthcare professionals who have been doing this for years and years and years still feel like this all the time. And, you know, I think it's just a part of the trade. We all feel like imposters. It's because we all strive to do the best for the patients, and we always want to know more and more. Like, how can we do things better? How can we be the best that we can be? Sometimes we need to appreciate how well we're actually doing and have confidence in yourself, you know? Have you studied this? Yes. Have you done this before? Yes. Like, that's amazing. It's such a proud moment when you're there and, you know, you can really be like, wow, I did that, you know? Imposter syndrome is just a sign that you care, which is amazing. So that's a wrap on everything I wish I knew before starting nursing school. If you're feeling overwhelmed or questioning yourself or your decisions, you're not alone. Everyone feels that at some point. Feel free to reach out to me in the comment section below or on social media, all linked in the description there. Nursing school isn't easy, but it's totally worth it. If you care and it's something that you're passionate about, you know, you'll go miles. If you're a fellow student nurse or qualified nurse, drop a comment below to tell me what you wish you knew before starting. Don't forget to like, subscribe, hit the notification bell, and I'll see you in the next videos. Thank you so much for watching. See you later.